Mastering Pain Assessment, a comprehensive guide using the PQRST-U method. Professor Rich RN here. I'm a nursing instructor, and today we're going to delve deep into an essential skill for every nurse, and that is how to conduct a pain assessment utilizing that mnemonic PQRST-U. It helps us remember, that mnemonic helps us remember key components to assess pain very thoroughly. Each one of those letters stands for a different aspect of the pain experience. P, provoking or palliating factors. What were you doing when this pain started? What caused it? What makes it feel better or worse? What might seem to trigger it? Stress, position, are there any particular activities? What relieves this pain? Medications, maybe massages, heat or cold, changing positions, active, resting, etc. And then what aggravates it? Any movement that's bending, lying down, walking, standing, etc. Those are some of the example questions that we can ask within this P category, or provoking or palliating. Q, quality of the pain. So here we want to ask our patient to help understand the nature of their pain. So ask them, how do you describe your pain? Is it sharp? Is it dull, throbbing, aching, or burning? Those are all great words to assist the patient in understanding or telling us where the quality of their pain is. R, region and radiation. So now let's look at this more. Where is that pain located? Does that pain radiate? Where does it feel like it travels or moves around to? Did it start elsewhere and then is now localized to one spot? Those are all example questions that you can include in this category of there are. I like to ask the patient specifically to use anatomical landmarks and then pinpoint the exact side of this discomfort. Because often they'll say, yeah, my chest area hurts. Well, that's a very broad area. So I say, can you use one or two fingers and point to where the pain's coming from, and they can point to that direct action. And then you can ask, does it radiate up or down, or etc. S stands for severity of pain. Here we want to assess that intensity. I often use the numeric scale from 0 to 10. In this scale, I explain to the patient that please rate your pain on a scale of 0 to 10, 0 being no pain at all, and 10 being the absolute worst pain you've ever experienced in your life or imaginable. That numeric scale is just one of many scales that you can use for the severity of pain. There's also the Baker-Wong scale, the FACES scale, the Flack scale, and a couple others that we can discuss in a later video, but the numeric scale is the most popular one. The T. T stands for the timing. Here we're going to ask our patient questions in regards to, obviously, time. When do you usually experience this pain? Is it during the day? Is it at night? Does it happen early in the morning upon waking? Does the pain wake you in the middle of the night? Does it lead to anything else? Is it accompanied by any other signs or symptoms? These are all questions, again, that you can ask your patient. You're not going to ask them all of these questions that we talked about in each of the categories, but you're going to narrow it down. So if you ask them, when do you experience pain? And they say, oh, it's only at night. And then you can say, well, does it awaken you at night? Etc. So you can just kind of go off their initial response. Mnemonic is U for understanding of pain. Here we're going to focus directly on the patient and their feelings and understanding of what they think is going on. So here, ask the patient, what does that pain mean to them? Is it much more severe than they've normally had? Is this a chronic condition that they normally have? And then also ask them, what do they think is causing the pain? Right? If they're complaining of pain, let's say in their right hip, and we ask them, what do you think is causing the pain? They might alert you, well, all of a sudden I've started, running 5 miles, and I've done that for the past 2 weeks. Well, maybe they have some sort of muscle strain that's due to the running situation that they've increased, right? So it'll give us tips of what's potentially going on in this patient's situation. So in that case, we would think maybe it's something to do with a muscle sprain or overuse injury instead of jumping to another issue. All right, and there you have it. A comprehensive pain assessment using the PQRST-U mode. I hope you had a wonderful day and excited to see you back again.